first time you come in the house?
Yes.
All right. Wonderful. All right. Ready? As soon as you start to read anything, everything just...
And I'm sure one question that everybody has is, what is glaucoma? And to answer that, I'm going to invite Dr. Donald Rhodd, ophthalmologist, to come and speak to us about glaucoma.
As you have heard, this little talk is going to be about glaucoma. So what is glaucoma? Glaucoma is an eye disease that involves or causes damage to the optic nerve. You have heard about the optic nerve in previous presentations. The damage is usually progressive and irreversible, and if untreated or inadequately treated, may lead to blindness. And of note, it is the second leading cause of blindness worldwide. So briefly at this juncture, we're going to just do a quick review of some of the structures which are important in understanding glaucoma. You have heard about the optic nerve, which is what glaucoma affects predominantly or essentially. Also, you'll see a diagram to the right which shows how the eye sits in the skull of your head. So you can get a picture of how that eye looks inside your head. So what's the optic nerve? The optic nerve is a large nerve at the back of the eye which sends signals to the brain. It is made up of nerve fibers from all parts of the retina. In glaucoma, some of these nerve fibers become damaged, so nerve signals cannot reach the brain. The damage to the nerve fibers is often caused by a buildup or increase of pressure in the eyes. In some patients, there is no increase of pressure in the eyes, but damage to the nerve fibers take place. This type of glaucoma is referred to as normal tension or low pressure glaucoma. In most cases, however, and most of the people we see in our practices in the hospitals with glaucoma, approximately 80%, the damage to the optic nerve occurs slowly and progressively and usually affects both eyes. This common type of glaucoma is called open-angle glaucoma. In few of the cases, the increase of the pressure occurs rapidly and more severely and usually affects one eye at a time, although the other eye may be affected later on. This type of glaucoma is called acute or angle closure glaucoma.
So I'm going to ask 4 questions for the presentation by Dr. Vaughan and Dr. Rhodd at this time.
What is happening when somebody with glaucoma, they can't see the dark until your eyes get used to the dark before you're able to see?
A lot of persons, when they, as I've told you before, glaucoma presents in the older age groups, above 14 or and many populations over 60. At that age also, patients begin to develop cataracts. There's an opacification of the lens, and particularly the central part of the lens. So when you go into the dark, the pupil, right, opens. So that cataract behind the pupil is not as, doesn't create so much limitation of light entering the eye. In light, the pupil constricts. The pupil is smaller, so it actually blocks out anything else getting around that opacity in the center of the eye. So the patient will tell you they can't see, but when they go into the dark, after a while, the pupil opens, and then there's a little light that gets around or that opacity and allow them to see.